In this video, I'm going to be demonstrating your suction and hold. I'm going to show you the right way, so where the back portion of the tongue is really lifted up, and I'm going to show you what it looks like when you're not getting a proper suction as well. So see those deep caves on each side of my frenum? That's where the back portion of my tongue is really lifted up, and it's really important that the tip of the tongue doesn't slide back like I just did there. So when you're doing your suction, you do not want the tip of the tongue to slide backwards like that. You want it to the spot and lifting up. This is an active exercise. You'll want to look in the mirror while you're doing it just to make sure things are looking good. And obviously everyone's anatomy is a little bit different, so your suction and hold is going to look a little different than mine. You can see that the back portion of my tongue is lifted when you get those deep dark caves on each side of the frenum. But then when I drop the back portion of my tongue, just to show you as an example, you can see that there's not really a supportive portion of the back portion lifting. It's kind of just sitting low in the mouth. Even if the tip of the tongue is still to the spot, that suction and hold is incomplete when the back portion of the tongue like that just kind of sits low. So you'll want to work up to getting that, that full suction. If you notice that your tongue overflows a lot on your teeth, you can kind of tap your teeth together a few times to push the tongue up within the palate. You can see I'm just demonstrating when the tip of your tongue kind of curls backwards or drags backwards, that is a compensation of the front portion of the tongue making up for a weak back portion of the tongue. So we're trying to even out these muscles so that they're functioning correctly and that the tongue is playing a really supportive role in your jaw and in your airway health. So here I have a really good suction. You can see that it drops a little bit while I'm like swallowing saliva. That's totally fine. That's what you want. So the back portion of your tongue, sometimes it will flutter a little bit. That's okay. You're really at the beginning stages of working that posterior portion of your tongue. So just do your best to keep it suctioned to the roof of your palate, and you're going to want to start in smaller increments, but the goal is to work up to 2 full minutes of doing this lingual palatal suction where the mouth is open about halfway. It does make the exercise a little more difficult. The more that you smile or the more you lift those cheeks up, it is a little more difficult to hold that suction, so you can play around with that as well, but you can still see that I haven't dropped my suction. Those deep caves are still on both sides of my frenum, and this is a proper suction and hold exercise.